The ACA is essentially a bill that extends coverage to about 30 million people, extends several regulations into the healthcare sector, primarily in the health insurance sector, and pays for all this principally by taxation and borrowing a good bit of money from Medicare. What's important is what the ACA doesn't do. The ACA doesn't bend the cost curve, for example, and most specifically doesn't address the cost crisis that we're going to see in the coming years in the Medicare program. Given what the ACA doesn't do, there are still some fairly high stakes in the election. Essentially what we've got to answer is how we're going to deal with the Medicare crisis in solvency. And there are two competing visions that I think the candidates have. Most specifically, candidate Romney and his vice presidential running mate, Paul Ryan, have put forth a vision which relies on the private sector in competition to try to moderate the cost of the Medicare program. I think if that goes through, we'll see in the future a great reliance on the private sector in our health economy and the uses of competition to try to make the health sector more efficient. President Obama has been less specific about how to address the Medicare cost crisis, but I think it's safe to assume that if President Obama is reelected, the vision going forward will probably entail more regulation in order to try to control costs in the healthcare sector, perhaps similar to what we see in European countries where, for example, entry into the marketplace to deliver healthcare services is regulated in an effort to control costs. So I think that the election has very important consequences for the future of the healthcare sector. It's really a vision, I think, of competition and use of market forces versus a more government-controlled and regulated solution.